visualized in the sagittal view, and in the second image is being visualized in the transverse view. In the sagittal view, the patient should be asked to lie prone, with the foot positioned off the bed in a fully flexed position. The probe should be oriented with the probe marker towards the patient's head. The probe should be moved distally from the mid-calf location to the calcaneal tuberosity. The Achilles tendon will appear echogenic with closely spaced hyperechoic parallel lines. The tendon will appear as a paintbrush appearance. In the transverse view, the probe will now be moved 90 degrees towards the patient's left side, with the probe marker towards the patient's left side. Again, the tendon will be scanned distally from the mid-calf location to the insertion site at the calcaneal tuberosity. The tendon in this view will appear echogenic with closely spaced dots and lines superior to the hyperechoic calcaneus, which will cast a posterior shadow. In this normal transverse view of the Achilles tendon, a hyperechoic bundle can be seen at the top of the screen and followed down. In this video clip, a normal sagittal view of the Achilles tendon is visualized at the top of the screen. As you can see clearly here, the tendons form a paintbrush appearance as the scanner moves distally from the mid-calf to the distal calf location. Tendon rupture findings. On sagittal view, often what will be visualized is a blunted tendon tip with a collection of fluid around this blunted tendon tip. In the transverse view, the ruptured tendon creates a mass-like appearance. Also, additional findings on ultrasound include non-visualization of the Achilles tendon, loss of its typical fibrillar structure, plus or minus a fluid collection, which is most likely a hematoma. In this particular view, a tendon rupture can be seen on sagittal view. In the left-hand picture, you can see the typical appearance of the normal tendon. On the right side, you can see that there is now a ruptured tendon, with the blunt end of the ruptured tendons clearly visualized in an anechoic area surrounding it, which is most likely hematoma. Here you can appreciate the loss of the typical fibrillar architecture of a normal tendon. A tendon rupture on transverse view demonstrates the loss of the echogenic fibrillar structure. An anechoic fluid collection is seen here. In this video clip, a ruptured transverse view of an Achilles tendon is appreciated. Here we can appreciate that there is a loss of the typical fibrillar structure and a fluid collection surrounding the tendon fibers. In this particular view, we can again appreciate a ruptured Achilles tendon in the transverse view. You can see a loss of the tendon architecture and surrounding edema or fluid collection seen distally. Return of the normal echogenic architecture can be seen towards the end of the video clip. In this view, here's another example of a transverse view of a transverse tendon rupture. Again, we see a loss of the typical fibrillar architecture and a very large fluid collection, most likely a hematoma. In this particular video clip, we can clearly see a ruptured sagittal view of the Achilles tendon. Here you see a loss of the tendon architecture as the scanner moves distally from the patient's calf. You could see blunted ends of the tendon with a large fluid collection surrounding it, most likely a hematoma. Here's another example of a ruptured tendon in the sagittal view. Here you can clearly see the normal paintbrush appearance of the Achilles tendon, which then devolves and shows a large fluid collection or edema surrounding the